An important part of occupational health is how work and the work environment can impact on workers' health. As an employer, you must make sure workers' health is not impacted by their work. Health surveillance is a scheme of repeated health checks which are used to identify ill health caused by work. Health and safety law requires health surveillance when your workers remain exposed to health risks even after you have put controls in place. This is because control measures may not always be reliable despite appropriate checking, training, and maintenance. Health risks which require health surveillance include noise, vibration, and substances hazardous to health. Health surveillance schemes should usually be set up with input from a competent occupational health professional. The law requires that health surveillance includes medical surveillance for certain hazards such as asbestos, lead, and ionizing radiation. Where medical surveillance is required, you must use a competent occupational health doctor appointed by the regulatory authorities, your client, as per the contractual and legal obligations, and it is called appointed doctor. But remember, there is also exception for some lower risk asbestos work. Health surveillance is not the same as health monitoring, health promotion, or health screening. It should only be used for workers who need it. It provides feedback about actions you may need to take to prevent further harm and protect workers. It allows workers to raise concerns about how work affects their health. It provides the opportunity to reinforce workers' training and education. Remember, we are talking about health surveillance. Here, step number two is how to manage the risk on site. Dear friends and fellows, you are on the platform of Safety First Life. If you are first time on this channel, kindly subscribe it and press the bell icon for all future notifications. And if you find the video informative, then like, comment, and share it with your friends and colleagues. Do you know your risk assessment will help you decide if you need health surveillance? There are a few important steps. Number one, you should look around your workplace and decide what may harm your workers' health. Number two, you should decide if you are taking reasonable steps to reduce risk and prevent harm. Number three, you should think about reasonably practicable improvements you can make, controls you can put in place to reduce risk. These are very important points. Your findings from health surveillance must contribute to your risk assessment and implementation of effective controls. Health surveillance can detect ill health effects early and show whether you need to review and revise your risk assessment and control measures. Control measures may not always be reliable despite checking and maintenance. Dear friends and fellows, there are other issues that can indicate whether health surveillance might be appropriate. It may include number one, previous cases of work related ill health in your workplace. Number two, reliance on personal protective equipment as an exposure control measure. Experience shows its use is not always managed properly. Number three, evidence of ill health in jobs in your industry. Number four, information from insurance claims, manufacturers' data, and industry guidance standards. These are the different ways how you can assess and manage risk in your workplace. Let us move to step number three. you need to consult workers about health surveillance. You must consult your workers and their representatives. Health surveillance only works with their cooperation. Consultation can help increase workers' commitment to health surveillance and compliance with control measures. Ask workers what they think the health hazards are in your workplace. Do you know they can help you identify workplace risks? They can make sure your controls are practical. And secondly, it is also your responsibility to make sure your workers understand the systems you have put in place to control identified risks and your health surveillance scheme. Why health surveillance is important and what is it for? What will happen if ill health is identified? They can attend health surveillance appointments during work time, and you, as the employer, must pay for the surveillance. Their own duties in law, for example, they must attend appointments. What action you may take if they refuse to attend health surveillance appointments. Dear friends and fellows, valid techniques are those that are precise enough to detect something wrong that could be caused by exposure to a health risk and which are safe and practicable to conduct. Health surveillance is a legal requirement in specific circumstances when there is still some residual risk to workers' health despite the control measures you may have put in place and they are likely to be exposed to. For example, noise, vibration, substances that are hazardous to health. You have to understand that health surveillance is used to identify occupational diseases such as chronic obstructive pulmonary disease, occupational asthma, dermatitis, and silicosis. These are the different occupational diseases, and you are conducting health surveillance to identify these occupational diseases. There are two terms, health surveillance and medical surveillance, and there is a big difference. After understanding the health surveillance, let us understand now what do you understand by medical surveillance? As defined in certain regulations, you must use medical surveillance where there could be exposure to certain high hazard substances or agents. A doctor appointed by the regulator, as per the law, as per the legal requirements, or at your work site as per the contractual obligations, must do the medical surveillance except for some lower risk asbestos work. This includes work with asbestos, lead, ionizing radiation, compressed air, or COSH. Another important step because as an employer, you are responsible that your workers are safe, healthy, and fit for the task. For the reason, for this purpose, you need to set up a health surveillance scheme. As an employer, you should put an ongoing health surveillance scheme in place where your risk assessment shows it is a necessary. When setting this up, you should consider all the health hazards for which health surveillance may be required. You should know which workers could be exposed to each health hazard and ensure they receive the appropriate range of health surveillance. You may also need to take advice from an occupational health professional. You may also need to identify who will lead and manage your health surveillance scheme. You may also need to agree roles, responsibilities, and communication arrangements. You may also need to consider the practical details of performing health surveillance, for example, shift workers and remote workers, etc. Dear friends and fellows, health surveillance is a step by step procedure. Identification, Identification by whom. What is the requirement? Health surveillance or medical surveillance? Then, how to manage risk at work. After the management of the risk, still there are few people, those are exposed. After completing the health surveillance process, here the step number 6 is act on the results of health surveillance. When your health surveillance is concluded, you must get feedback from the occupational health professional who carried it out. Until you have received this feedback, your health surveillance is not complete. Feedback should include advice on fitness for task with the relevant exposures. And when further health surveillance is required for each worker undergoing health surveillance, you should also enter this information into the individual health records that you must keep. Very crucial and important points by the auditing point of view. How to maintain the record, how to keep the record, and what should be in the record as an employer or as a representative of the employer. You must act on the results to protect workers where health surveillance shows they have work related ill health. If further investigation is required, this should be done in a timely manner in discussion with the occupational health professional. For example, if an occupational health professional advises you that a worker is not fit for a task, consider assigning the worker to alternative work where there is either restricted or no risk from further exposure. I'll continue on the results. I'll go in depth what feedback might be from the occupational health professional and how to complete the health surveillance program or process, biological monitoring, biological health effects, and biological surveillance in the upcoming training session. Thanks for watching and don't forget to like, comment, and share the video. Hope to see you soon with a new HSC tutorial. Until then, take care. Good luck and goodbye.